Thanks, everybody. It's really hard for me to just stand behind here, so I'm going to have to move. I'm going to pass some things out. And just so you know, I know this is an ugly orange. I do it on purpose, so you won't lose it with amongst all your other things. But yeah, thank you so much. Let's see. Oh, shoot. Yeah, this is me. So the Minnesota Oral Health Coalition is made possible by a grant from the Delta Dental Minnesota Foundation. You know, people say, we wouldn't be here without you. We really wouldn't be here without them. So I always want to say thanks to them. And before I get into the MOHC, I just want to thank you for having me. This is a really big deal. I'm a huge fan of your work. Just love it. And you've made me kind of a big deal in my national groups because they're like, oh, you're from Minnesota. Oh, the dental therapy. And I'm like, yeah, I know. So little do they know. You're the ones doing it. But yeah, it is pretty fun to be from Minnesota because of all of you. So what I'm going to do is I'm going to talk about where we came from, what we're up to, and hopefully invite you to at least join. You don't have to, but it's great if you do. We are actually working on a new strategic plan, and we'll have it in December. But right now, our mission is to support Minnesota's oral health community through partnerships, resources, and outreach. And our vision is optimal oral health for all Minnesotans. Pretty clear. So a history about us. In 2008, 2009, the Minnesota Department of Health Oral Health Program started putting on yearly conferences where they did a lot of planning in the name of the Oral Health Coalition. The Centers for Disease Control and Prevention, I'll back up. So most state oral health programs are not funded by the state, including ours. It's kind of bizarre, right? So I always say to people, can you imagine if the state didn't fund our medical director? That'd be pretty outrageous. So the state doesn't fund our oral health unit at the Minnesota Department of Health. The Centers for Disease Control and Prevention has 5-year grants, and they fund 16 to 21 states a year. So we really rely on them to keep our our oral health program at the state of Minnesota. Well, in about 2008, 2009, they started saying to states, look, we love funding you. We're so happy we can fund you. But rather than giving you a grant, let's do a cooperative agreement. And a cooperative agreement is a grant where they give you money and you do something specifically for them. And they said, all states that get our funding must have a 501c3, nonprofit, independent, statewide oral health coalition. So in 2008, 2009, and some of you might have been at those meetings, they started doing a lot of planning. In 2014, Delta Dental of Minnesota came forward and said, look, we'd really love to fund the coalition. So that's when they brought me on. I can't believe it's been that long. It's just kind of hard to think about that. But just a little background. So when we started the coalition in 2014 and we got our nonprofit tax status, everyone said, well, what are you guys going to do? And I said, well, you know, there's been a lot of planning for years. Why don't we take 2 or 3 years and not do any planning? Let's do some conferences. Let's do some products. Let's create some systems. Let's get people to know each other in a different way. And then we'll do some planning. So we did our first strategic plan in 2018. And like I said, we'll have our 5-year update soon. So one of the reasons I say I'm a big deal nationally is I want you to know that your Minnesota Oral Health Coalition is actually part of an American network of oral health coalitions. So we have a national association. And this is really important because a lot of the work that we do in Minnesota, whether it be the Oral Health Coalition or the state or your association, we get to share it nationally. And for me, because I'm a one-person shop, it's really nice because I feel like I have this, I have this team with me. So I really, really appreciate it. And we're actually, we call it ANOC. ANOC is actually growing and becoming more policy focused, which is always a good thing. I think we need more of that. So what do? We encourage and leverage partnerships to build a strong foundation for oral health promotion and access in Minnesota. Oh, sorry. And we develop programs, products, systems to enhance and support our Minnesota oral health community. So I get a lot of phone calls of people and they think I'm a clinic, right? Or they call and they want to know, different things about payment methods. And when we did our strategic planning in 2018, we're really purposeful. And we said, we're here for you. We're here for the providers. We're here for the educators. We're here for schools. We're here for Head Start. We're here to support those that are doing the oral health work. We can do it too, but we want to make sure that we're filling that gap wherever there's a need. Sorry, I have. This is the only group I can say it to. I have horrible driving off. Yeah, seriously, no one else would be like, oh, what's that? Yeah, I did. Thank you so much, Cheryl. I love that stuff. Yeah, just a quick thing. I actually had head and neck cancer this summer, which was really bizarre because I was so angry. I'm like, what? So it's HPV related, short story. It was in a lymph node. It wasn't anywhere else. Had that taken out. So I'm coming out of radiation, so that's why. Like I said, I don't normally tell people, but this is your, if I can't tell you guys, who can I tell, right? So this is our website. I wanted to spend a little bit of time talking about actually what we do. And when I talk about programs and products and systems, let me see how I'm doing for time. I'd like to think we do a lot, and it's all because of our members. But I'm going to pick and choose a few things. And if anyone is curious about anything, they can ask me now, or you can always get a hold of me. We have a policy and learning committee. And I know that sounds a little weird. Most 501c3s have what's called a policy and advocacy committee. But what we learned really early on is that our membership and the dental oral health community is so diverse. So for us to say, look, this is a great bill. You guys should really support this. That doesn't really work for us, right? We're not in that position to tell you what you should support legislatively. So we decided, what we'll do? We'll have a committee where we share what's going on at the Capitol, we talk about different policy issues, and then we help support you all in having the skills and the experience that you need to advocate for what you think is important with your legislators. So one of the things we've done is virtual Hill visits. That's where you set up meetings with your legislators. And I'll talk about it in a minute, but we do these things, they're webinars, I call them infomars. But we've done an infomar on how to do a Hill visit. How do you get a hold of your legislator? And how do you talk with them? What's that all about? I have a good friend, she's a PhD, super smart, and she said, I have no clue. I have no clue what that's about. I can't even touch it. And I thought, well, it's really about experience, because you can be a smarty pants and still not understand how that world works. We took a little hiatus with this committee to do some tweaking to it. It'll come back in January. So it's something you can join if you want to. We do conferences. Another thing we do is called an oral health showcase. So think of when you go to a conference, and we've got all these folks here that are sponsors and exhibitors. We actually set up an exhibit hall in the basement rotunda of the Capitol. And we invite every legislator, their staffers, anybody that wants to come down, and then we talk about our issues. And it's been really, really great because it's so different. I didn't come up with the idea, so I can brag about it. But it's very, very different. This year, what we're going to do is we're going to take it a little step further and make sure that we set up individual meetings. So when legislators come down, they've got a time and they can sit with someone and talk to them. But again, it's all about getting the professionals that do the work, who know the field. Nobody knows the field like you do. So you should be talking to your lawmaker about your subject, right? I shouldn't be doing it. And frankly, we don't want a lot of other people doing it, if you know what I mean. So so that's one of the things that's important to us. We had a lot of feedback about dental assisting and how there's such a huge shortage, and I know there's shortages in other workforce as well. So we took a project from North Dakota. They gave me permission. they looked at Gen Z, and they said, Generation Z, if you look at the research and what they want in a job, it fits really nicely in with dental assisting. So we created some materials, and we really tried to sell dental assisting the way you'd sell anything, right? Toothpaste or dental floss, anything that you'd sell. Because we knew that our market was really friendly for this. And so we did a number of things with this. We did some education with all the school guidance counselors, so the high school guidance counselors. There's almost 1,000 of them. So we got a hold of them and said, look, talk to your students about dental careers. Infomars, those are our webinars, and we usually put them on our YouTube channel. So if you join and you get the newsletter and you're like, I can't make that, I'm in clinic, you can always watch it later. During the pandemic, a lot of you guys might know Claire Larkin. Claire got a hold of me and she said, this is really an unbelievable time for our profession. We've never seen anything like this. We should somehow capture this. And I said, what do you mean? She said, well, we should do something like a time capsule or something so that when people come into the profession later, they can understand what we lived through, what we practiced through. And I don't know how many of you have heard of this, but there's a product called Tribute.co. And for $99, you can send an email out to 1,000 people, and they can record something and put it up on this Tribute website, and they put together a video for you. So I said, we don't have a ton of money. We can afford $99. So we asked a couple questions, We said to people, do the Tribute. You can take 2 minutes or 10 minutes and answer a couple questions about your experience through the pandemic. And I think we had 45 people do it. So we've got this amazing video where people are talking about their experience as dentists, dental hygienists, dental therapists, dental assistants during COVID, during the pandemic. Yeah, I always tell people it's really a neat thing. I learned it because a friend of mine had a big birthday, and her husband sent it out and didn't tell anybody. And they were at the cabin on her birthday, and he had a table set up with a laptop. And he said, come look at this. I said, no way. She goes, I'm not doing a Zoom birthday party. You can just, And he goes, no, just sit down. So she called me later that day. It makes me cry. And she said, I had an hour of people telling me they love me on this video. And I thought, oh, God, that kills me. I'm sold. So, just so you know. So we have that. We're starting to do some more media. I have a media communications background, so I've done some media training. If any of you are interested in that, I love to do it. I did it for the U.S. Department of Transportation, which is another story. If you want to learn how do you set up a news conference? How do you talk to the media? How do you get interviewed? What does that look like? I'd love to do it. It's super fun. And if we have time, we record you, and then we look at it and go, here's how you looked. And usually you look really good compared to what you think you look like. So, yeah. So this is just kind of a splattering of, we have a public information campaign. It's on our website. It's called Meet Your Mouth. It's part of your body. And so I was going to bring samples, and I thought, you don't have time for samples. Just go to our website. So right now we have 15 topic areas. So like your mouth and vaping, your mouth and infancy, your mouth and pregnancy, and things like that. And then on our website, you can go to a folder that has probably 3 to 4 little infographics on each topic. So if you want to put it on social media or things like that, or put it in your newsletter. And those topics will grow as people say, you missed this. You should be doing X. We'd like to know this. But I always think of the 5th grader that calls me. I go, what's that 5th grader going to do? So when the 5th graders call, I don't know why 5th graders, but when they call me, I go, hey, go to our website. Use Meet Your Mouth. So yeah, this is kind of a splattering. Like I said, there's other things. And I should say that 99%, probably 90% of what we do is someone just calling me and going, how come there isn't XYZ? And I go, I don't know. And then we look around, we see if someone else has done it, or maybe someone should do it better than us. And then we go, oh, let's do it. If you need it, someone else is going to need it. Our infomars, like I said, there are webinars. I just got kind of inundated with webinar emails, so I thought, oh, we'll do infomars. So yeah, I've done a media basics, collaborative dental hygiene practice, teledentistry. If you guys haven't heard about Yonder, that's a really interesting, it's an app. So yeah, you can Google that or look that up. But Yonder app was developed by two non-dental people at the University of Minnesota for a class. And it's an app that helps children get ready for their first dental appointment. It's really cool. So they came on and did it. And we have a YouTube channel, it's all there. But just trying to find out about things that people either want to know about or they've never heard about, and we're like, well, let's bring that to our membership. Normandale Community College built a really great collaborative dental hygiene practice toolkit, and then Normandale got new leadership and said, take it, get rid of it, we don't want it. And we said, oh geez, we'll take it. So it's ready now. If you look on our website, you'll see the tab. But just to give you an idea of the kind of things that we're into. Okay, here's another one. Everyone told me, never do this. It's such a bad idea. I'm like, oh, then I should do it. Oh. So we had some grant money, and we gave a stipend to several people. They took a region of the state, and we came up with a list of clinics who said that they would accept patients with government insurance, sliding fee, or no insurance, and they'd be willing to be on a website. So that's what this is. I know it's not a perfect science. I hear about it all the time. But it's better than nothing. And I get calls, and they're like, oh, my boyfriend needs a dentist, doesn't have money. So I send people there. So they either don't call me back because I'm driving them crazy, or they don't call me back because this has worked for them. But I really don't hear from people more than once. So you can look by region or by zip code. But yeah, so it's, again, we're just trying. No, it's not a perfect science. Totally understand that. Yeah, this is Meet Your Mouth. And actually, I have a grant writer now, and she said, what do you need grant money for? I said, I want the mouth to talk. I want the mouth to kind of walk around and say things, And she's like, well, that's bizarre, but we can ask for money for that. So yeah, it's kind of fun. And these are some of our topics. And again, it's kind of like, hello, you have a mouth. It's part of your body. That's kind of the preface of this. And this is just how one of them looks. That's the vaping. So this QR code takes you back to our website where you can find more information. So it's kind of like, well, where did you get this from? Well, here's where we got it from. So yeah, it's been really fun. And I love when someone calls me and they go, do you have anything for vaping? Do you have anything for seniors? I'm like, yeah, we do. Yeah, and then we have these infographics. So they're real easy for social media. Wouldn't that be fun if the mouth talked and moved? It takes so little to make me happy. And this is our dental assisting recruitment project. And again, we just looked at the data that was there and the profession. I think what we found about dental assisting holds true for dental therapy and dental hygiene as well. But we have a lot to brag about. This is a great state for this career. So, and then we did a map so people can look at where the schools are. So medical dental integration has become a big deal for us because we're always trying to work on the access issue. And I didn't bring a lot of legislative things to talk about just because it usually takes me a lot longer. We know in 2021 we had a really great year at the Capitol, and we got an increase in reimbursement rates. So there's been, the legislature's been good to us. We're still working on it. Last year we got, they passed a bill that we worked on to give basically forgivable loans to nonprofit clinics so they can buy equipment or update their structure, their infrastructure. We asked for 25, and I think we got 2.5, but that's how it goes in St. Paul. Still good, not complaining. So because access is such a big issue for everyone, including us, we started this, we call it a community conversation. So the first Wednesday of every month at noon, we're on Zoom. The Zoom is on our website, and I send it out to everybody as well. It's on our resources page. We'll have a speaker, and then people will just share things. And sometimes we're on for 20 minutes, and sometimes we're bucking right up to that hour. Just kind of depends on where the conversation goes. And what also happens on these are people bring up questions. They say, well, isn't there a blah, blah, blah? And we go, I don't know. We'll do some research. We'll look into that. But yeah, just another way for us to try to, bridge that access gap. And I talked a lot about our YouTube channel. It's really easy to find. So there's my little screenshot of it. Let's see. I talked about the planning, policy and learning committee. This is something, we're working with Delta Dental in Minnesota, and before I go any further, this isn't a Delta event where you're going to talk about insurance. In 2019, Dr. Eileen Crespo, some of you know her, she's a medical director for Delta. Thank you. She and I hosted this, and we just brought medical and dental folks together. And we said, let's just do kind of a social hour. So we set up some ways that people could kind of speed date and get to know each other. Just the idea that if there's a physician or an RN and he or she says, gosh, Sue's here for this, but her mouth really needs looking at. Then she'll go, I went to this event and I met a dental therapist. I'm going to call him. I'm going to call her. So those cards are going around. I didn't bring 50 because if you're not in the metro, you don't want to go. But this just went out on our, if you look at our YouTube, if you look at our Facebook or Instagram, you'll get this code and you can register. It's free, and it's just like wine and beer and food and just some activities. But again, it's just a way for medical and dental, we try to bridge that gap. One other thing I want to talk about, I know I'm just right there. So the really homely orange cards, one of the things we did is, years ago I had 2 pediatricians on our board, and they both said to me, we're really lacking a good fluoride varnish training video. The ones we used to use, they're not so good anymore. So we did a training video, and it's like 4 minutes. It's the knee to knee. We shot it at Hennepin Healthcare. And then we did a parent guardian video, because I thought, well, that's great that people can learn how to apply fluoride varnish, but what about all those parents or grandmas or guardians, and they're saying, what is this? So we did a brief, it's like a 3-4 minute video, and it's like, what is fluoride varnish? Why are you applying it to my child's teeth? How is it applied? How do we take care of it once you've done it? Can they eat right away? That kind of thing. So we did it in 8 languages, and we've increased it. We now have 21 languages. So that's what that orange card is. They're all on a playlist on our YouTube channel. And just so you know, you can always reach me if you have any questions about this stuff, because I'm going fast. But yeah, and if you somehow want it, you want it in a disc or something, call me. But the idea is that if you're in clinic and you have someone from the Ukraine and you're doing fluoride varnish on their child, you can play that video for them, and they can understand it. And I always tell folks, we're a stress-free, guilt-free zone. I used to tell everyone, we're the first nationally recognized guilt-free zone organization. And people go, oh my God, I didn't even know that was a thing. And I go, well, I made it up. But I always want people to participate and use us and become part of what we do. But please know, I'm never going to be the reason you feel stress or guilt. So if you join our board or you come to a community conversation and we never see you again, we still love you. So there's no stress, there's no guilt. Yeah, so I think I'm out of time. But if you have any questions or you just want to talk to me, or when my taste buds come back, I love wine. I'll always meet you for happy hour. But yeah, just thank you for letting me, be here with all of you. I really appreciate it. Like I said, I love your work, so thanks.